Well, it's hella rainy outside today, so I figured I could probably knock out a few videos, try to do something today, because
Science
it's, man, last night was crazy.
Scientists have tried to conquer the mind.
Oh, but yeah, I was scrolling through YouTube and I found this and I was like, what the hell is a lobotomy? And then it said the worst surgery in history, and I kind of thought, like, I was thinking maybe they might talk about, like, this kind of surgery, like, in medieval times or something. And that's what kind of interested me. Like that, I was like, if they talk about that, I would want to know, because I feel like surgery back then was fucking crazy. Like every time I go to the dentist, if they like have to do something to my teeth, man, sometimes it'd be hurting. And I'm like, dude, imagine if we couldn't numb our teeth. Like that would be so painful. And it's like, well, that's how they used to have to do it. And it's like, well, it's not even just with teeth. Like if someone had to get a limb amputated back then, like if they didn't have morphine and stuff, like, So I don't know. It's fucking wild, but that shit like kind of interested me. So I figured, I don't even know what a lobotomy is, so I'll learn what that is, and I'll learn why it's the worst surgery in history. That way, if anyone's ever like, bro, because I feel like I've heard that before. So if anyone's ever like, bro, you think I should get this lobotomy? I'll be like, nah, bro. Don't you know it's the worst surgery in history?
Mind.
I know.
Through many different ways for many different reasons. One such is in the treatment of mental disorders. Experimental science has, in some of its most controversial studies, shed a light into how the brain works. We have seen this in this very series with the monkey mother,
The
baby
brain is.
Albert, and Milgram experiments.
I wanted to see that video because I've seen that.
How about the treatment of mental disorders in a world before modern day medicine?
Wait, so lobotomy is trying to fix a mental disorder? Can you even fix mental disorders? I know like pills and shit with chemicals that your brain is missing or something, but
Drug-based therapy.
surgery?
Around the mid-20th century, a form of invasive surgical procedure would gain praise for being able
Like,
to
look at that.
tackle the problem of
just
overcrowded
holding them
mental
down.
hospitals and treat the previously untreatable. It would eventually be known as the lobotomy. The surgery would go down in the annals of time as a barbaric and cruel procedure, which would
said
leave
the
behind
annals?
thousands of patients in its wake with devastating side effects including confusion, incontinence, seizures, and in some cases even death. One of the main characters in the story of this surgical procedure would describe the operation as surgically induced childhood. Eventually the surgery would become synonymous with the mishandling of mental health and the running roughshod over patients' rights. As such, I'm going to rate this dark page in scientific history a 9 on my plain difficult ethical scale.
I don't know this
Welcome
man's scale,
to the dark side of
but
science.
that sounds high. I would assume out of 10, 9 out of 10.
It is the turn of the 20th century. Mental health institutions throughout Europe and the USA have become dangerously overcrowded. During the 19th century, where scientific discovery took leaps and bounds, many attempts to treat the mentally ill had failed, leading to
That's
a
a nice
large
photo for
population
the
of
back
incurable
then.
patients.
That's like 1080p.
This was due to many industrialised countries having national systems of regulated asylums. These institutions sought out care for patients that had been disposed of in the system by their families, poor houses, and the criminal justice system. With no proper ways of treating inhabitants of the asylums, many different forms of medical procedure were tested on the unfortunate patients.
What the hell?
There are many gruesome types of treatment on offer in the early 20th century. In 1917, malaria therapy was introduced, where a patient would be deliberately infected with the zoonotic disease to induce fever to fight neurosyphilis. In 1920,
syphilis.
the barbiturate-induced deep sleep therapy for premature dementia, aka precocious madness, or in its modern name form, schizophrenia. This treatment used drugs to keep patients unconscious for days or even weeks.
Wait, what was he using?
Schizophrenia, premature
DMT?
dementia, induced deep sleep therapy
Oh,
for
deep sleep.
premature dementia, aka precocious madness, or in its modern name form, schizophrenia.
So they
This
just put
treatment
you to
used
sleep
drugs
for
to keep
schizophrenia?
patients unconscious for days or even weeks. In 1927, you might have been given insulin shock treatment, which used the peptide hormone to induce daily comas In 1934,
What the hell?
patients could be prescribed with the first type of seizure therapy, where a patient would be deliberately induced into convulsions by the use of PTZ. This therapy would be superseded by the more familiar electroshock therapy.
So they're giving them seizures to help their seizures? What the hell kind of sense does that make? And then the everything else, they're just putting them to sleep. Like, what the fuck?
Although these treatments could cause long-term lasting psychological and physical trauma,
I would think
the
so if your
patient
brain's
had
asleep
not
for so
undergone
long.
a surgical procedure to eradicate the disorder. But in 1935, in Portugal, a doctor named Antonio Moniz would change this when he performed the first leucotomy on a patient. The leucotomy, in its
Almost
most
100
basic
years ago.
form, was the deliberate damage of brain tissue in order to treat mental illness. The name would later be changed to a more recognisable name when the procedure spread across the Atlantic Ocean, but that will come later on in our story. The thinking that inspired Moniz was that mental illnesses originated from abnormal neural connections
Ouch.
in the frontal lobe. Moniz had seen the after effects of soldiers who had received injuries to the
So
frontal
basically,
lobe,
they've
in which the veterans would show
hurt your
a
brain
calm and
to
quiet
fix you.
disposition. The brain is made up of two types of matter, grey and white.
Ooh, imagine your
Grey matter
brain getting
is the
poked.
brain's
Like,
neurons
how
and
sore would you
associated
feel?
blood vessels and extensions.
Fuck that, dude.
The white matter is the nerve fibres that connected to the areas of grey matter and carry messages between them through electrical impulses. Moniz theorised that by severing the white matter fibres from the frontal lobe would improve the patient's mental illness. Although in theory this might make sense, the connections within the brain in reality are far more complex than what was thought at the time. The
We
group
still don't
procedure
even know about
in
the
its
brain,
first
do
form
we?
would
Like, not
involve
everything.
drilling holes in the skull
Like, what
either
are
side of
dreams?
the prefrontal cortex and injecting the connecting
Well, actually, to be honest, I was thinking about that too. I was like, what are dreams? Because they're crazy, you know? Sometimes there's like deja vu, and then other times it's just like, you know, you feel like it means something. Or like sometimes you can even like dream of a certain person, and then the next day they somehow reach out or something, you know? Like, dreams are just unexplainable. But the way I heard it recently kind of made me think a little bit different. He said, think about he said an apple pie, but I mean, I guess you could really think about anything. Like, think about an elephant. Like, nothing around it, just an elephant. Think about an elephant. Now, where is that elephant? You know, like, you're not physically seeing it. You're not standing like wherever they're located, you know. You're not like in Asia and seeing an elephant right in front of you. You're just seeing it somewhere in your head or some other plane. And basically they were saying like that's basically like your dream. It's just a bunch of random shit in this area because there's no direction. I don't know, I feel like it was explained a little bit better, but at the same time, like, even just that, like, whenever you could picture something, like, how can you picture that and put it in a place? Like, your brain is fucking cool, dude, and it's so weird. And then even while you're asleep, it's still like moving and working, you know, and it's making your whole body do stuff. It's so wild. And then they're gonna poke it and like stab it just to make you fucking, or cut some out of it to try to make you normal. Like, ooh, like, I mean, you know, when you get like a fucking injection, you know, the next day you're like, oh man, I'm fucking sore, you know. Imagine your brain, even if you're asleep for like a few weeks, like, then you're missing a part of it. Like, that could be a lot. Especially 100 years ago, almost 100 years ago, they probably didn't even know what all those areas did. Like, they're probably still finding out more shit the brain does, you know.
Fibers with
I
alcohol
don't know,
to
man.
destroy them. Moniz found this method to not yield very good results due to the solution damaging much more than the white matter. A tool was developed called a leucotome, which looked like a long stick with a retractable wire loop inside. It allowed the operator to insert a metal loop into the brain, which was used to sever the white matter by extending and then retracting said loop. The process cut 6 cores in the white matter of each hemisphere using the new tool. Because the procedure involved cutting through the skull, the patient had to be operated on in a proper operating theatre under general anaesthetic. To test the theory, Moniz enlisted neurosurgeon
Well, I guess we're not going to talk about
Lima to conduct the
this.
Surgery
Wasn't
on 20 test subjects.
like way back
Of these
when.
initial 20 patients who were suffering from depression, schizophrenia and anxiety, Moniz claimed 7 cures, 7 improvements and 6 unchanged cases, although the results were open to interpretation. Moniz claimed that the risk of some behavioural and personality deterioration outweighed the debilitating effects of severe psychiatric illness, which is understandable when taking mental health care at the time as a contextual background. A second set of patients were
Mental health is so
operated on
strange.
due to the success of the first trial. These 18 patients all suffered from schizophrenia, and 3 were considered as almost cured, and another 2 had also become improved. Moniz did conclude that patients that had deteriorated considerably from their condition pre-procedure did not benefit much from the operation. In a well-known
They cut
quote
out his
from Moniz,
background.
he described his radical new surgery. Prefrontal leucotomy is a simple operation, always safe, which may prove to be an effective surgical treatment in certain cases of mental disorder. The procedure would eventually earn Moniz a Nobel Prize in 1949.
He said it's always safe. Yeah,
But initially,
okay.
Moniz's
Messing with
new
your
way of
brain.
treating the thought to be untreatable was widely derided by the medical community. In 1936, Moniz published his results through articles in the medical press and a monograph, but to little attention. On the 26th of July 1936, one of his assistants gave a presentation at the Parisian meeting of the Société Médico-Psychologique on the results of the second test subjects, the 18 people suffering from schizophrenia leucotomized by Lima. This meeting wouldn't go down well, as the lead doctor at the institute in Lisbon, who had supplied the first set of patients to Moniz, was also in attendance and widely denounced the after effects of the surgery.
What does that even mean?
Saying that patients who had returned to his institute post-operation were diminished and had suffered a degradation of personality. Further adding that the initial results of calmness and improvement were more likely attributed to the severe shock of the surgery and ultimately from the horrible brain trauma that the procedure induced on its victims. Many other physicians denounced the procedure, but bizarrely, this isn't the end, as several individuals
and he said it's always safe.
thought Moniz's leucotomy could be useful on an experimental basis on severe patients, and as such, the surgery was spread throughout Europe and even.
Wait a second. Well, that doesn't even make sense. They start finding out all this bad stuff, and saying like obviously like okay it didn't work and it actually made some people worse. I mean they had their good cases, but I mean those bad cases were like bad, and those good cases weren't even what, half, maybe about half. Why the risk though? Why would they spread it? I don't know. Do people still do lobotomies?
US during the mid to late 1930s, and this leads us down an even darker path.
Go beyond subscribe.
Welcome
Man,
back. You're about to witness
that's
the
fucking wild,
magic.
dude.
Show some
Like
love to your
surgeries
favorite
in general.
creator. Click join and become a channel
Like who
member.
figured it out? Who figured out like, yo, maybe if I go into this dude's
Think of
brain
all
and
you've
cut
made
this certain
since.
part.
Colorful cakes,
I mean,
gelatinous
obviously they had to have had
masterpieces.
before that, like, okay, well,
Join so
this
they can make more
certain
what
part
they
of the
love, and
brain
you can feast on
kind of
members'
does
only
this and
goodness,
does
like a
that
secret
and thinks
banana
about this
cake
and that.
recipe.
But then
Who
it's like,
knows? It's up to them.
can you really
and
break down what someone's
Join the
thinking just
channel,
by their
give first,
brain?
and show the love.
And if you can, that's fucking weird. Reading people's minds?
It is here that we are introduced to American doctors Walter Freeman and James W. Watts. Inspired by Moniz's new surgical procedure in 1936, the duo performed their own leucotomy. Walter had learned of the procedure after a chance meeting of Moniz at the London-hosted Second International Congress of Neurology in 1935. The American was fascinated by the surgical technique. Upon returning to the US, Freeman started communicating with the Portuguese doctor. Moniz, during the correspondence, promised to send a monograph on leucotomy and urged him to purchase a leucotome of his own. Upon receiving the paper on the procedure, Freeman reviewed it and set about with his colleague Watts on experimenting with the surgery, which led to September 1936. Seeing flaws in the surgery, Watts and Freeman developed their own variation, which renamed the procedure the standard prefrontal lobotomy, to differentiate it from the Moniz method. This version severed more of the white matter and would be the de facto method moving forward for lobotomies performed in operating theatres. Walter thought that the lobotomy could be streamlined even further still. The new standard procedure had the same shortcoming of the Moniz method, and that was access to the brain. You see, cutting
look
through
at
the
that
patient's
scar, bro.
skull required the operation to be conducted in an operating theatre, with all the trappings, anesthesiologist, qualified surgeon,
There's just a bunch of
hygiene,
people that fucking
and so on and so
cut
forth.
people open and do shit.
Walter had heard of an Italian doctor,
Science
Amarello
doctors.
Fiamberti, who had performed the leucotomy by accessing the prefrontal lobe through the eye socket in 1937. Fiamberti's method was to puncture the thin layer of orbital bone at the top of the eye socket, and then, much like Moniz's early experiments, inject alcohol into the white matter, or in later surgeries, cutting the white matter with a hypodermic needle. Walter took this process and modified it using probably one of the most unlikely of tools.
A screwdriver?
This is a surgical tool. Or is this a surgical tool? It's hard to tell, as one was used in psychosurgery and the other is an ice pick. Well, the similarity is not
It's an actual ice
coincidence,
pick?
as Freeman's improvements on Amarello Fiamberti's transorbital lobotomy replaced the needle with an ice pick. In
I don't like
development
that.
of
I don't
this
like
new
that.
method, Freeman took an ice pick from his own kitchen and started practicing on a watermelon. He would eventually graduate to using cadavers. The thinking was that if the lobotomy could be performed without exposing the brain, then it could be performed by psychiatrists in psychiatric hospitals, allowing more people to be operated on. These are the tools used to the Freeman transorbital lobotomy. A new tool called the orbitoclast, essentially an ice pick with markings along the side, and a hammer. The method would involve the patient being either under anaesthetic or electroconvulsive therapy used to render the subject unconscious. Then the orbitoclast sharp end is placed under the eyelid.
You can electrocute someone to sleep?
The hammer is then used to penetrate the surgical instrument through the thin layer of bone and into the brain along the line of the bridge of the nose, eventually going 5 centimeters deep. The orbitoclast was then pivoted 40 degrees at the orbital perforation, so the tip cut towards the opposite side of the head. After this, the tool was then hammered in a further 2 centimeters into the brain. Again, the orbitoclast was pivoted around 28 degrees each side to cut outwards and again inwards. Once this was complete, it was removed and the process was repeated on the other eye socket. The first patient to receive the procedure was in 1946, but once Freeman's partner Watts had heard about this new method, he left their practice, disgusted at the transorbital lobotomy.
He said, nope.
But like every other
Get me outta
chapter
here.
in the story, this would not hamper the procedure's prevalence. The lobotomy had now been transformed.
Did he go under the
from a
eyelid?
serious surgical procedure of last resort to a 10-minute doctor's office job. Along with this came
He went
severe
under the
lack of
eyelid?
follow-up care and monitoring, which led to high relapse rates. Because of this, towards the end of the 1940s, nearly 20,000 people in the US had received the procedure. But not only that, the transorbital lobotomy would spread across the world and even back to the leucotomy's home grounds of Europe, spreading further still to the Soviet Union and Japan. To get a lobotomy in its late 1940s peak, you really didn't need to have much of a mental health condition. With the treatment touted for all
I did not
kinds
think
of
this was what
ailments,
lobotomy
the list of
was,
treatable
man.
illnesses with a lobotomy included, but was certainly not limited
I thought it was
to
like Botox type
ADD,
shit.
OCD, anxiety, PTSD, postnatal depression, chronic pain, Alzheimer's, criminality, and violent outbursts. Freeman, ever the showman, was responsible for a patient's death in 1951 when pausing a lobotomy to pose for a photo, in doing so causing severe brain hemorrhaging. He was even known to lobotomize 2 patients at the same time, one with each hand. The doctor even performed the operation on minors, including children as young as 4.
He was just fucking
In
shoving
total,
it in
around
and moving it
15% of
around.
patients
He
who
wasn't even
received
being
the lobotomy
precise.
died, but many more were changed for life, a shell of what they once were. For
Yeah, I
those who
bet.
survived the ordeal, relapse would often follow.
Mm.
But like its first unveiling to the world in Paris in 1936, the procedure didn't go uncriticised. In the late 1940s, as Moniz was set to receive his Nobel Prize, multiple voices in the medical community spoke out on the barbaric procedure. But it wouldn't be criticism.
That's a pretty good
that
word
suddenly
for it. It is
banning
pretty
the
barbaric.
procedure in
Fucking
the USSR,
wild.
but the synthesization of chlorpromazine, the first antipsychotic. As a side note, Soviet psychologist Dr. Nikolai Orozhevsky was quoted saying that lobotomies violate the principles of humanity, and that was from an official.
I mean, you're messing with someone's
1950s
brain. You're literally
USSR.
scrambling their
The procedure gradually
brain.
fell out of vogue, but Freeman would continue to perform the lobotomy all the way until 1967, when after their third lobotomy, one of Walter's patients died of a hemorrhage. This final procedure would get him banned from performing it ever again. The USSR wouldn't be the last to ban lobotomies, as even Moniz's Portugal would disallow the procedure from use.
So
With
we
further
all let it
developments
stop.
in drugs such as SSRIs,
Besides a couple,
antipsychotics,
or like,
and types of therapy like CBT, the need for surgical intervention slowly faded away, and by the 1980s, lobotomy became a thing of the past. Now, how would you rate the lobotomy on my ethical scale? 1 being good,
shit. Ugh, I don't like that one, dude. That was fucking. That's like wicked, man. Who thought about that? And this dude was using ice picks at first, or did he just practice with ice picks? Like, what the fuck? Who thinks of stuff like that? And then I don't know, man. That's just weird, man. Like it looked like it was under the eyelid, pushed into your brain, and then they like scramble it. Ugh. And then they go even more and scramble it some more. And then they do the other side too. And then what? Most people ended up relapsing and still having their mental disorder, and the other ones died. And then even the ones that like didn't relapse, I'm sure they were just like fucking like they're not the same person, you know? And I mean, I'm not saying that that's a bad thing, but at the same time, if you're like a walking shell of a person, that's just weird, man. It's just, I don't know. That's a strange surgery. I don't know how we ever, or how this man ever got away with it, and how he got it spread through everywhere. Or multiple, actually. He's not even the first one. But I don't know. I hope that thing don't exist no more. If anyone ever asks me for a lobotomy, say no. We know that now. See ya.